Okay, so for my final lab project, I decided to do the exercise physiology lab. Exercise physiology is the physiology of physical activity. In other terms, means the evaluation of many different parameters like the heart rate, temperature, oxygen intake, and etc. Today, we'll be reviewing the question and answers from the exercise physiology pre-lab, along with one educational component that has a strong relation to the lab. On to question one, part A. As exercise begins, the rate and depth of respirations increase. What is the physiological difference between exercise hyperpnea and pathological hyperventilation as might occur during a panic attack? So to continue with part A, the answer is hyperpnea increases due to the breathing rate and breathing depth as compared to rest. This typically occurs while or after exercising. Hyperventilation is the overventilation that occurs when a person begins letting out too much air that they can't take in. Part B, cardiac output increases significantly during exercise. What are two ways the heart can increase cardiac output? Two ways that the heart can increase cardiac output as a result of exercise is increased contractility and stroke volume. An increase in contractility is otherwise known as increased heart rate. Both of these are an effort to deliver needed oxygen around the body. Question 2, look at the baseline in the table and fill out the rest of it with your predicted changes during exercise or recovery. So to compare, keep in mind, I recorded these back in lab, so I did make the notable changes because I realized some of them were incorrect. So heart rate, the baseline is 65 beats per minute, and the change during exercise is that you should expect it to increase, and during recovery, you should expect it to decrease. Tidal volume, the baseline is 0.5 liters. You expect that to increase and decrease during recovery. The respiratory rate, baseline is 12 beats per minute. You should expect it to increase during exercise and decrease during recovery. Now, this is one of them that I had messed up when I originally did it. Hemoglobin saturation, the baseline is 99%. And at first I said the change during exercise was the same, but then I looked back and did some research and realized that it decreases during exercise and then increases to get back to the threshold in recovery. The carbon dioxide clearance, its baseline is at 0 liters per minute, and the change during exercise is that it increases and decreases during recovery. The oxygen is another one I got wrong. I got mixed up between the two. So the baseline is 0 liters per minute, and it actually increases during exercise because there's a major need for it and gradually goes down during recovery. The temperature is a baseline at 37 degrees Celsius. During exercise, your temperature will increase, and during recovery, it will slowly get back to threshold at 37. And finally, the mean arterial pressures is set at 100, and this was actually one of them I got wrong. I realized that it slowly increases during exercises, and then it decreases during recovery. On to question 3, what happens when heart rate, blood pressure, hemoglobin saturation, carbon dioxide clearance, oxygen consumption, and body temperature during an acute bout of exercise, during recovery, and why do these changes occur? Okay, and on to answer 3. During exercise, heart rate, blood pressure, carbon dioxide clearance, oxygen consumption, and body temperature all increase. On the contrary, hemoglobin saturation decreases because there is only a limited percentage available to fulfill the blood's need. During recovery, heart rate, blood pressure, carbon dioxide clearance, oxygen consumption, and body temperature all decrease back to threshold. But hemoglobin has to increase it to get back to its full potential. All of these changes occur as a reaction to the exercise and to satisfy the body's need that allow it to keep moving properly. Question 4, compared to a pH of 7.4, hemoglobin at a pH of 7.5 binds to oxygen more or less strongly, causing it to release more or less oxygen into the tissues. The answer to number 4 is that compared to a pH of 7.4, hemoglobin at a pH of 7.5 binds to oxygen more strongly, causing it to release more oxygen into the tissues. This proves to be true because of the Bohr effect, which causes hemoglobin to pick up oxygen entering your blood from the lungs so it can transport it to your tissues via the Education Seattle website. On to question 5. What is the control in this experiment? The control in this experiment was exercise that was being exhibited. That one was a pretty simple answer. The final question is an exercising subject has the following measurements. Tidal volume at 2 liters, the percentage of oxygen exhaled in the air is 10.9%, the carbon dioxide of exhaled air is 5%, the respiration rate is 20 breaths per minute, and the heart rate is 100 beats per minute. Calculate oxygen consumption and carbon dioxide clearance. Show your work in the proper units. The answer to number 6, the carbon dioxide clearance, I will first read the equations. The equation for carbon dioxide clearance is tidal volume in liters times the carbon dioxide per minute equals the percentage per minute. The oxygen consumption is tidal volume in liters times oxygen per minute equals percentage per minute. Now, with the numbers actually in there, the carbon dioxide clearance turned out to be 2 liters times 5 carbon dioxide per minute equals 10% per minute. The oxygen consumption was 2 liters times 10.9 oxygen per minute equaled 21.8 per minute. Okay, so my educational component, I decided to choose the coronary artery disease. It is a disease that causes less blood flow to the heart from the arteries, typically from a buildup of plaque. It is a very common disease across the United States, and the effects of this disease could be as little as having no symptoms, as moderate as having chest pains, or as intense as a heart attack. There are multiple treatments for this disease, such as medication, exercise, and surgery, but there's no cure. Okay, so I'm going to talk about the exercise treatment. Exercise is a great way to combat the effects of the coronary artery disease. The most important aspect of this treatment is safety, which is why it would be required to speak with your doctor first. The doctor will recommend exercise based off the level of intensity of the activity. This intensity is judged by the target heart rate they would like their patient to reach. This is very beneficial because it helps a patient from overworking themselves, which could prove harmful. Examples of ways to test the intensity while you're actually doing the exercise and correct oxygen intake include if you can't talk or exercise at the same time, you're exercising too hard. If you can't talk while exercising, if you can talk while exercising, you're doing fine. If you can sing while you exercise, you may not be exercising hard enough. Okay, so to review my educational component, the main idea to take away from my educational component is to learn an example of a disease or complication that affects the different parameters of exercise physiology. After researching for a disease that fits the bill, I decided on coronary artery disease because it has a big impact on the way people exercise within safe limits. People with this disease must learn that it is more difficult for their body to circulate blood in the arteries, so they need to have a plan. For example, if this lab used participants with this disease, the intensity may have been reduced to prevent harm. And here are my sources.